All right. Hi, my name is Dr. Raynard Riley of Patient First Dentistry of Summit. And today I'm going to talk a little bit about Invisalign. Now, Invisalign is a form of orthodontics where basically it's a method by which we move and correct teeth that may be out of position. Now, I'm a general dentist and I do Invisalign, and you have orthodontists that do traditional braces. Invisalign is a service that I provide in terms of shaping and moving teeth to improve people's smiles. Now, for myself personally, I use Invisalign in my practice as a form to maybe even help people who have had some teeth that they may be adults, for instance, and not really happy or satisfied with the position of their teeth, but they don't want to go into wearing braces. This is where Invisalign comes in, because it's a method that we can use to help correct smiles without the traditional brackets and bands and wires that are fixated on the teeth. And for some people, or for those who don't know how Invisalign works, Invisalign works by using a series of mouthpieces, which we call aligners. And each aligner sort of moves teeth in segments. So, for example, when your teeth are in a particular position, and let's say, for instance, you have a space between different teeth, you would wear one aligner, which gradually nudges the teeth a little bit, and then after that, in sequence, you would wear the next aligner. And when you wear the next aligner, it gradually nudges the teeth a little bit more, and then you go to the next aligner, and so on, and so on, and so on, until the desired position is reached. And that's pretty much how Invisalign works. Typically, what we do in my practice is we take a series of photos, x-rays, and impressions of the teeth, and what we will do is submit that, and we will get back a computer-generated simulation where we can actually sit down and show the patient what the start position of their teeth is and what the teeth will look like at the end of the Invisalign treatment, and actually get an idea of how long the treatment will take. So actually right now I'm actually fielding some questions from a few people in the area who may have some additional questions about Invisalign. Hello?
Okay. Yeah. Okay. Well, I have a question. First of all, do orthodontists who do the regular braces, do they do Invisalign also?
Well, you do have some orthodontists who do both, who mix both Invisalign and traditional braces in their practice. Invisalign, every individual is different, and you have some cases where the traditional way of moving teeth actually would be better or more effective. And then you have the cases where Invisalign can be as effective as orthodontics. And then it's up to the actual individual patient, where the individual patient may or may not want to have metal wires, so they choose Invisalign. So some orthodontists choose to offer both options to their patients.
Yeah, that's wonderful. Now, in terms of like the treatment, I know that normal braces take usually a couple of years. So what about Invisalign? Is it about the same, or does it take longer or less time?
Less time. Most Invisalign cases are usually about a year and a half in treatment. But then again, it all depends on the individual's individual needs per se. So it all depends. And again, if you think about some people who you may see who have had braces, and they anticipate or they're told their treatment will take about a year, and a year and a half later they're still in braces. It's the same thing with Invisalign. It's a computer-generated simulation where it gives us a rough estimate of how long the treatment will take, but one is a simulation, the other individual Invisalign is actual real life, and sometimes it doesn't match up, so sometimes it takes a little bit longer, or sometimes it finishes up before the actual anticipated treatment.
Okay. All right. Now, I've heard that this aligner, this Invisalign mouthpiece can actually be taken out after or during eating and after flossing or for flossing. Is that true?
That is true, and that's actually the beauty of Invisalign. I've seen cases where individuals have had orthodontic treatment, and after having those braces for a long period of time, it's very difficult to maintain and keep their mouth clean. And when the braces come off, the gums can be a little irritated and inflamed. The beauty of Invisalign is it's a removable appliance. So you can remove the aligners while eating and flossing and drinking and things of that nature, and then it's easier to brush and maintain and keep everything clean, and then you can wear the aligners afterwards. So that is the advantage. I would say the disadvantage of Invisalign is with traditional braces, when the braces are on the teeth, they're fixated, they apply constant pressure to move the teeth. With Invisalign, it's removable. So if you don't wear them, then they're not going to work. So it's critical that you wear those trays as much as possible every single day, and only remove them to eat and brush and maintain your teeth.
Okay, that's understandable, but it does give me, let's assume I am, and let's assume I'm. Let me first ask another question: are they really invisible? Can people, if I talk to a person, if I go tomorrow on my job, and I sit on my desk, and people walk up to my desk and ask me a question, will they see that I'm wearing Invisalign? Yes or no?
Most people won't see it. And I'll tell you a story. My dental hygienist actually is going through Invisalign right now, and none of the patients ever know. And when I tell patients or inform patients about Invisalign, the first person I point to is my dental hygienist. And they say, wow, I didn't even notice. So they come in, they talk to my hygienist, she cleans their teeth for an hour, and they don't even know. I have to point it out to them. Now, if most people are looking and staring in your mouth, they might see something. But 9 times out of 10, people just don't see. It's a very discreet appliance. So that's hence the name Invisalign. So
it really is Invisalign. That is wonderful, and that's really wonderful. And at the same token, let's assume, especially at the beginning, a person is extremely conscious, so a little bit overconscious, and then he has this job interview or this first date, and if he really thinks that, like, look, I don't trust it that people don't see it, okay, if he takes it out for that one time and is otherwise very religiously about wearing it, he basically, he got a cake and can eat it too. He has.
Yeah. I'm glad you mentioned that, because again, that's the beauty of Invisalign. You can take them out when you're eating. You can take them out to brush and maintain your teeth. And also, if you have a date or an interview and you just would feel more confident without the trays, well, you can go ahead and take the trays out for an hour or two, and it doesn't affect your treatment as long as you're consistent throughout the duration of each aligner period of time.
Great. And do I need to come in to the dentist as often as I have to do than I do for the normal appliances, where you have to come every couple of weeks to adjust the whole thing, or every 3 weeks? Are you just how does that work? Are those trays, those appliances, are they pre-made, and or are they made every time we need to change them? Because I guess they get always changed to put more new pressure on it once the tooth is adjusted to the new position, and then a little more new and a little more new, so you get new appliances. Are they made on that time and have to come in and every time do an impression again, or is that pre-computerized?
Well, typically the way how it works, and the interval that I like to see my patients, is roughly every 6 weeks, every 4 to 6 weeks, but typically every 6 weeks. And again, the aligners are pre-made, and it's sequenced from start to finish. So what I normally do is I have my patients, when I start a case with a patient, I will give them a set of aligners. Now, each aligner or tray, if you will, is worn in 2-week increments. So basically, if I start a patient, I give them a pair for the top and bottom. They will wear that for 2 weeks. After 2 weeks, they will switch to the second pair, and they will wear that pair for 2 weeks. Now it's a month. They will switch to the third pair. After that, in 6 weeks, they come to the office, and I'll check the teeth, make sure everything is going okay, and then I'll give them another set or 3 more pairs of aligners, and so on and so on and so on. So the way how it works is it's all pre-packaged, it's all made out, and we give our patients a calendar and a schedule to help them remember when to go from one set to another. So to answer the question, yes, you would need to come in, and roughly the interval is about every 6 weeks.
Wonderful. And those appliances do work for young people also, like, the normal children or teenagers who usually get their appliances, or is it only for adults?
Well, back I would say in the past when Invisalign first hit the market, there was some, I would say, a lot of dentists were reluctant to use Invisalign for teenagers. And the issue is compliance. Like I said before earlier, if you don't wear the trays, it's not going to work. The pressure and the movement comes from the trays. So, teenagers, they may put the trays down, they may lose them. That was the issue. But now we do have Invisalign Teen, which has markers and things that will help children or teenagers be more compliant and wear the aligners as well. So Invisalign is not just for adults, it's for teenagers as well.
Oh, wonderful. That's all the questions I had.
Okay, well, thanks a lot. It's great. Thanks for your questions. And again, if you have any other questions, feel free to reach me in my office.